Hello everyone, this is Vaishnavi and today I'm going to discuss about the topic amyotrophic lateral sclerosis, which is a neurodegenerative disease. So ALS is defined as a progressive nerve cell disease which affects the nerve cells in brain and spinal cord. And Lou Gehrig is the first person to be identified or diagnosed with ALS, and he was a baseball player. Coming to the etiology of ALS, mostly the etiology is unknown. It's idiopathic, and only 5 to 10% of the cases with ALS they are seem to be inherited. Okay, and there is even complex interaction between genetic and environmental factors. Coming to the genetic part, so like mutations you can see in SOD1 gene, that is superoxide dismutase gene, TARDBP mutation, CORF72 mutation, TBK1 mutation, and even you can see this mostly in athletes. Coming to the risk factors, the genetic heredity only contributes for around 5 to 10% of the cases, and coming to the age, it's common in 40s to mid 60s, and males are slightly highly prone to this compared to females, and this difference disappears after the age of 70. Like after the age of 70 years, both male and female are equally prone to this disease. Coming to the genetic, like I've said you right, there'll be some mutations in the particular genes. And environmental factors include smoking, menopause, and exposure to certain toxics like lead, and the person in a particular occupation, okay, at workplaces like that, and military services, exposure to metals, chemicals, viruses, and even certain trauma injuries can contribute. Coming to the pathophysiology part, there will be death of upper and lower motor neurons. So when there is a death of motor neurons, there will be degeneration of motor pathways. So I've mentioned earlier, there will be mutations in certain genes like TDP43 genes, and those proteins aggregate in the affected neurons, in the neurons where the disease is proliferating, and disease is starting, and this proliferates, this aggregation proliferates, and it leads to the progression of the disease. So the damaging processes includes protein misfolding and aggregation, loss of axonal transport, disruption of neuromuscular junction, axon demyelination, oxidative stress, mitochondrial dysfunction, RNA processing impairment, neurofilament aggregation. So all these are the processes which leads to the damaging of motor neurons, which leads to the degeneration of motor neurons. Once the motor neuron is degenerated, the motor pathway is degenerated, and there will be no motor response, like there will be no motor actions. Coming to the role of TDP43 gene, which is also known as star DNA protein 43, it has a role related to mRNA related processes, like it mimics the mRNA related processes in nucleus, like transcription, splicing, maintaining the RNA stability, and RNA processing. Coming to the role of SOD1 genes, these all are the genes which are mutated in causing ALS. SOD1 is known as superoxide dismutase 1, which is located on chromosome 21. SOD1 gene instructs the superoxide dismutase, which is an enzyme. This superoxide dismutase is an enzyme which binds to the copper and zinc to break down the toxic charged oxygen molecules, which are known as superoxide radicals. If not, these superoxide radicals will be accumulated. Okay, so the function of superoxide dismutase is to break down the toxic charged oxygen molecules. So, coming to the brief pathophysiology of ALS, motor neurons. In motor neurons, the cell body, there is mutation in SOD1 gene. I've already discussed the role of SOD1 gene. So, if there is mutation in SOD1 gene, it leads to the formation of SOD1 aggregates in neuronal body, which ultimately leads to the mitochondrial dysfunction, neurofilament aggregates in the axonal body, and there is a impaired glutamate intake. Okay, impaired glutamate intake. Glutamate is responsible for nerve health and communication, and there is even axonal dysfunction. Okay, if there is neurofilament aggregates here, even ultimately it leads to the dysfunction of axon. And here the oligodendrocyte is responsible for production of myelin, but as I already said, in pathophysiology there will be axonal demyelination. So oligodendrocyte even cannot produce the sufficient amount of myelin. Ultimately, the motor response cannot be reached the muscle, and the muscle will be affected. Okay. Coming to the complications of ALS, mostly you could see the breathing problem, and it is the number one cause for the death of patients with ALS. Rather than dying with the ALS, respiratory failure is one of the main cause for the patients for their mortality and morbidity. ALS affects the muscles which are involved in respiration, so the person cannot breathe, and ultimately it can even lead to the respiratory failure. So for that, the remedy is going with the BiPAP, bi-level positive air pressure, to prevent the respiratory failure during night times. And second option is tracheostomy, that is creating a surgical hole at the front of the neck, which is leading to the windpipe, that is trachea, where there will be use of a respirator which inflates and deflates the lungs. Second one, speaking problems. Even this problem is seen mostly where it starts occasionally and there will be mild slurring of words, but it becomes so severe and there is the patient feels so difficult in speaking, and even the opposite person, he feels so difficult to understand the words. So the only remedy is that they have to rely on some kind of communication technologies to communicate with others. Coming to the eating problems, the muscles controlling the swallowing part is usually affected. Okay, the muscles which are supporting this part are usually affected, so the person cannot take the adequate amount of food, so subsequently he'll be malnourished and he cannot take the proper proportions of water, so he'll be ultimately dehydrated. So for that you have to go with the feeding tubes, and there's no other way. You have to make the patient hydrated properly. And even these patients are at higher risk of developing pneumonia, because there is a loss of muscle control over here, right? So whatever the food you take, liquids and saliva, there is a higher chance of these substances to get lodged into the lungs, so ultimately the person might develop pneumonia. And coming to the dementia part, last one, there are certain problems with memory and decision making. Okay, so this is usually known as frontotemporal dementia. Coming to the clinical features, it includes difficulty in walking and carrying out the normal daily activities, and there is a chance of tripping and falling. There will be weakness in legs, feet and ankles. There is even hand weakness and clumsiness in hands. There is I already said you right, there's a complication in speaking. So there is even the slurred speech and trouble swallowing, muscle cramps, inappropriate crying, laughing and yarning. Cognitive and behavioral changes could also be observed. ALS starts in hands, feet or limbs and eventually spreads to other parts of the body, affecting chewing, swallowing, breathing, and speaking. If chewing and swallowing is affected, the person might be at higher risk of developing weakness, or he'll be malnourished. If there's a problem with breathing, then it may lead to respiratory failure. Speaking, like there's difficulty in communication. To discuss with the diagnosis part, it's actually difficult to diagnose a patient with ALS because ALS usually mimics the other neurological disorders. So some of the techniques used here is electromyogram. Electromyogram is a technique which involves the insertion of a needle electrode via skin into various muscles, and now after insertion of this needle electrode, the electrical activity of muscles during the contraction and the relaxation state is observed. And this electromyogram, based upon the electrical activity of muscles, exercise therapy can also be decided. And second one is nerve conduction study. This test ability, this test is just to know the ability of nerve to send impulses to muscles in different areas which are far away. See, the origin of the nerve may be different from the place it is reaching to. So it tests the ability of the nerves to send the impulses, and it can even determine the nerve damage, certain muscle damage, and other nerve diseases. And MRI, as you all know, like it uses the radio waves and high frequency magnetic field, high intensity magnetic field, and it produces the images of brain and spinal cord. Blood and urine tests are also used to rule out the other possible causes, and lumbar puncture, like some fluid from the from spinal cord is taken between two vertebrae in lower back, and it is observed. And muscle biopsy, it is usually the small part of muscle under the general anesthesia. It is taken and it is sent to lab to see the. Coming to the treatment part, which is the important part of the topic, riluzole. Riluzole, it was the first drug approved by FDA, which is a glutamate antagonist, and the dose is 100 mg per day. It is available in both oral and liquid forms. So coming to the mechanism of action, it reduces or it decreases the glutamate release by binding with the sodium channel and interfering with the downstream events, and even it affects the axonal release of glutamate. So it is usually believed that in pathophysiology, excessive exposure to glutamate is one of the main reasons for cause of ALS, because of the axonal demyelination and the subsequent events. So once if there is decreased glutamate release and appropriate intake of glutamate, one of the major factor was inappropriate uptake of glutamate as mentioned in pathophysiology, right? So if there is a appropriate intake of glutamate, the effect of ALS might be reduced. So the areas includes asthenia, spasticity, and high increase in aminotransferase levels. The second drug is edaravone, which is an antioxidant and free radical scavenger, which decreases the oxidative stress and cell death. So the dose is 60 mg, which is given intravenous for 1 hour. It is given over 1 hour infusion per day, and this is given for 14 days. After 14 days, there is a drug-free period or a drug holiday, during which the whole drug is washed out. After the drug-free period, again the same daily dosing for 10 days is done. Like for in the span of 14 days, the dosing is done for 10 days, and it is followed by again a 14-day drug-free period. Coming to the mastinib, it is an oral tyrosine kinase inhibitor, and the dose is 4.5 or 3 mg per kg per day, and it is given for 48 weeks. The mechanism of action includes the neuroprotective effect on microglia, macrophages, and mast cells in central nervous system and peripheral nervous system. And mastinib is, instead of using alone, it is used in a combination therapy with riluzole. Okay, and the areas include maculopapular rash and peripheral edema. Coming to the fourth drug, tofersen, which is an antisense oligonucleotide. Oligonucleotide, usually the role is to produce myelin sheath. Okay, so 2% of cases of ALS were due to the mutations in SOD1 gene. Okay, like according to a research, and SOD1 gene is involved in degeneration of motor neurons. We have already discussed in pathophysiology. So if there's overproduction of toxic SOD1 protein, there is degeneration of motor neurons. So the mechanism of tofersen includes that there is decreased synthesis of SOD1 protein, and it is given as a lumbar intrathecal injection, and the dose is 100 mg, and this is given for 3 months. And the benefits of tofersen includes increase or improvement in breathing capacity and improvement in muscle strength and function. And there are certain adverse events like mild to moderate headaches, procedural pain, because during the procedure of lumbar intrathecal injection, there will be some pain experienced by the patients, and there's post-lumbar puncture syndrome and even falls. And coming to the ravulizumab, which is a long-acting monoclonal antibody, it blocks the terminal complement C5 activation. See, actually, if the terminal complement of C5 activation in general, if it activates, there will be neuroinflammation. So if the activation itself is blocked, there will be no neuroinflammation, right? The inflammation rate will be reduced. And mesenchymal stem cells. The mesenchymal stem cells are derived from bone marrow, and these cells secrete NTFs. They are neurotrophic factor cells, which are involved in growth of nerve tissue and even in protection, protection of neurons. So the mesenchymal stem cells are also one of the therapy included. So coming to the non-pharmacological treatment, apart from the pharmacological treatment, the person can even use a ventilator for breathing problem, and if there's difficulty in walking, then he can go for the wheelchair use, and based upon the complications he's getting or he's facing, he can consult a physical therapist or occupational therapist, respiratory therapist, a dietitian, or a speech pathologist even. And you need to treat the symptoms like accordingly. There is even symptomatic treatment, like for muscle spasms. If there's muscle spasms, you need to go for muscle relaxants, and for hypersalivation, pseudobulbar effect, and for cognitive impairment and depression, you need to go for the respective treatments. Like, you need to go for the symptomatic treatment, and this way you can just reduce the severity of the symptoms the patient is facing. That's all for the topic ALS. It's just a brief discussion on this topic. You need to go through more and more for further information. I just explained it briefly for a rough idea. Thank you. Hope you all understood my video. Thank you.